that anxiety, that despair, this belief, this true, and they truly believe it. Persons with true imposter phenomenon truly believe that they are less valuable, that they can't contribute, and they can't perform on par with their colleagues. And you're right, that really does deeply impact their psychological well-being, and they carry this with them throughout their training and well into their career. And that has real impact, just impact on the individual, in terms of their well-being, but also if we really want to start looking at its association with how are you contributing to your healthcare organization's delivery of healthcare services? If are you optimized as a provider? And if you're not optimized, is it imposter phenomenon that is the barrier that is preventing you from becoming a full service provider?
Well, hello, future CRNA. I have some exciting news to share with you today. We have just released the Nurse Anesthesia Educators Unplugged, which is going to be your gateway to success. I want you to discover the inside scoop. I want you to be able to navigate the complexities of CRNA admissions and thrive as a candidate and as a nurse anesthesia resident, which can seem like a really daunting task. But what if you had a trusted guide at your fingertips? Which is why we're excited to introduce the Nurse Anesthesia Educators Unplugged, which is CSBA's private podcast, your one-stop auditory guide to achieving your CRNA dreams. The key benefits and features of this private podcast will be hearing directly from the experts, listen to seasoned CRNA faculty members who know the admissions process inside and out, get invaluable insights not found in brochures or websites. You're going to hear from behind the scenes and discover the lesser known details of the selection process, traits that faculty look for in candidates, and the hidden pitfalls to avoid. Also, knowing that all schools are a little unique, and this is going to give you that invaluable insight that's going to allow you to see the differences between different CRNA programs and the faculty that run these programs. You're going to hear real stories, hear from successful students who have been in your shoes, learn about their challenges and strategies, and what made them stand out. You're going to get strategic advice. So beyond grades, how can you learn to craft a compelling application, such as for your essay or your interview responses that really will resonate with the admissions teams? You're also going to get flexible learning. You can listen to this podcast on your commute, during your workouts, or even while cooking. So we want this learning to fit your schedule. You're going to hear a lot of Q&As on these podcasts. These questions and answers are found in our private CSBA community. So again, we pick questions that are commonly asked from CSBA students, and we bring them to the table during this faculty podcast. So it's a great way to hear commonly asked questions from a variety of faculty and different insights on that. We also want you to stay up to date. The admissions landscape is always changing, so we want to make sure that you're updated on the latest trends and requirements and strategies for success. And then last but not least, we want to help you build confidence. Knowing what to expect and how to prepare can dramatically increase your confidence, giving you the edge during the application interview process. So I hope this sounds exciting to you. I hope you're as pumped as I am to tune into these shows. And remember, if you're a CSBA student, you're going to have access to this private podcast. But don't worry, we want to make sure we're not excluding anyone from this podcast. And so on occasion, we're going to share sneak peeks with you, our regular CSBA listeners, because again, I want everyone to succeed. And whether you're a CSB member for 12 months or for a short period of time, if you are a member, you're going to have access to the entire library of private CSBA faculty podcasts. So again, this is a really valuable resource that we are excited to bring to you today. And I want to just leave you with the conclusion that whether or not you're contemplating CRNA career or you're already deep in the application process, this Nurse Anesthesia Educators Unplugged is your secret weapon to equip yourself with the knowledge, strategies, and confidence to stand out. So I hope you enjoy the sneak peek. Let's go ahead and get into today's episode.
All right, guys, welcome back to another great episode of Nurse Anesthesia Educators Unplugged. We're excited to have you here with us today and listening to this, and very excited about the guest that we've got with us today. I want to introduce you to a guy I met a couple of years ago. I believe it was actually on a bus going from ADCE, the Assembly of Didactic and Clinical Educators. We met up, and just hit it off. And looking and listening to some of his research, which we're going to get into, what he's been looking at here on imposter phenomenon, really just sparked a lot of interest as we look at the population or the group, the members that we're reaching here with the podcast. But let me go ahead and introduce him. We've got Dr. Jeffrey Darna here. I will read you all the letters behind his name because I want you to know how credentialed this man is and everything that he's done. PhD, DNP, CRNA, acute care nurse practitioner, and also a fellow of the American Association of Nurse Anesthetists. Going along with all of that, he's also a program administrator and the assistant professor of clinical anesthesiology at the University of Southern California, Keck School of Medicine, program of nurse anesthesia. Dr. Darna completed his acute care nurse practitioner education at Yale in 2003 and his nurse anesthesiology residency at Central Connecticut State University, Hospital of Central Connecticut in 2006. In 2013, he obtained his practice doctorate from New York University, emphasizing the transition of care in high-risk patient populations. Got his PhD from the University of San Diego. There, his research was focused on the imposter phenomenon in nurse anesthesiologists, which is what we're going to focus on today. And his interests included healthcare policy, executive leadership, and translational science. So Dr. Darna provides anesthesia services at the VA Greater Los Angeles Healthcare System. So not only is he educating, he's also practicing. And he is the past president of CANA, the California Association of Nurse Anesthetists, and various committees as you look in task force throughout the American Association of Nurse Anesthesiology. And he and I were both, and it was a pleasure to be inducted into the Fellows of the AANA with him in 2023. So a lot of great background here, guys. And Dr. Darna, I want to welcome you to our episode today.
Hey, Rich, thanks so much for having me. I'm really excited to be here and particularly excited to be able to talk about imposter phenomenon today. It's something that I'm really, really interested in, and I think it affects a lot of people, and happy to share my research and my thoughts on it, and hopefully that helps current and future nurse anesthesiologists and nurse anesthesia residents who are about ready to embark in this huge transformation.
Yeah, it is a big, big deal. And, imposter phenomenon is one of those terms that 4 or 5 years ago, we really never heard much about. It may have come up a little bit in the literature, may have come up a little bit in conversations, but as you kind of look at the research these days, we're starting to see a lot more of that terminology being utilized and looking at what effects it has, not just in the practice setting, but also with the training setting. But before we even get there, how about clearing it up for us? So when you talk about imposter phenomenon, what's that definition? What does it look like?
Yeah, I think that's a great question. And just to kind of, before jumping into the definition, yeah, we certainly have seen a lot of evolution in the construct of imposter phenomenon. It's a 50-year-old construct, and we've seen it kind of wax and wane in, we can thank social media really for revitalizing interest in this particular construct. So let's start with definitions, because I think it's always important to make sure that we define what we're talking about, because then if we have more of it helps us understand more of a common language or, what we're working with. So where I use for my particular research, and mind you that they're just like everything, like all concepts and theories, they evolve. But for my particular research with nurse anesthesiologists, I said that imposter phenomenon was the self-perception of intellectual phoniness and professional ineptitude, despite this clear evidence of success that's often experienced by high-achieving individuals. It results in avoidance behavior, professional underdevelopment, and psychological distress. So people with imposter phenomenon feel like a fake. They feel like a phony. They feel as though they've been deceiving their colleagues, deceiving the people around them. They tend to discount praise, and they attribute any success that they have to either luck or perhaps some type of error or misjudgment by somebody else. Now, it's a pretty big definition, and there's a lot of stuff that's packed into that. And it seems like I'm being a little nuanced in it, but it does have uh, an application to what we do as advanced practice nurses who specialize in peri-anesthesia care, and particularly when we look at intellectual phoniness, meaning, where somehow we think, I got into this program, I'm not as smart as everybody around me, and they're gonna, at any moment, they're gonna find out that I'm really not as smart, right? Or when I get into the clinical setting, and boy, you know what? I'm not really good at putting in this central line. I can't do this. I don't know what I'm doing. They're gonna see that I am going to flounder in a matter of minutes. And as a result of that, what we tend to see is people with imposter phenomenon or imposter syndrome, which is tends what the lay population uses. Imposter phenomenon is the more preferred term. Is we see those individuals avoiding these type of spotlight activities and perhaps even acquiescing a clinical skill, an advanced clinical skill, to another provider. So no, physician anesthesiologist, why don't you go ahead and place that central line? You know what? I'm not feeling so good today. Why don't you go ahead and do the nerve block? And I'm not going to do. I'm not. My scanning abilities aren't really that great. You know what? I've done enough scanning. I don't need to do this POCA scan, this gastric scan, or the FATE exam, or what have you. That often results, though, in a lot of distress to the individual, psychological distress, anxiety, depression, and even burnout. So,
So interesting that you mentioned that, because I'm going back to kind of one of the things you mentioned, talking about how they are really kind of selling themselves or really not selling themselves. And a lot of times we think, okay, and we've even joked about it, right? That, I don't even understand why I got in anesthesia school. We've maybe even said, I don't even think I can do this skill. There's definitely smarter people than me. We also can contribute that to sometimes people trying to be humble. But we're talking about something on a completely different level here. We're talking about really kind of that mental health aspect, that not only,
yeah,
with humbleness or how did I get here, that doesn't lead to what you were talking about, which is what we see in the imposter phenomenon, is that feeling of ineptitude, that feeling of distress, that feeling of really kind of withdrawing from some of the educational opportunities or professional opportunities, because there truly is something there that creates that anxiety in them.
that's right. That anxiety, that despair, this belief, this true, and they truly believe it. Persons with true imposter phenomenon truly believe that they are less valuable, that they can't contribute, and they can't perform on par with their colleagues. And you're right, that really does deeply impact their psychological well-being, and they carry this with them throughout their training and well into their career, and that has real impact, just impact on the individual, in terms of their well-being, but also if we really want to start looking at its association with how are you contributing to your healthcare organization's delivery of healthcare services? If are you optimized as a provider? And if you're not optimized, is it imposter phenomenon that is the barrier that is preventing you from becoming a full service provider? We tend to see imposter phenomenon in very young and budding and aspiring individuals. So again, to the audience here that's listening to this, those critical care nurses who are very interested in making that transition from being an ICU practitioner into becoming a nurse anesthesiologist. And if they truly have imposter phenomenon, that certainly can really uh, limit their pursuit of their dream. Right? They've got this vision, this dream of wanting to do it, of becoming that nurse anesthesiologist, and then they have unchecked and unregulated, unmanaged imposterism, and that certainly could limit their ability, their full potential. And even in some cases, they may get into a program and they may say the first semester, "Oh my God, I made a mistake. I can't do this." And they're going to find out that I faked my way in here and I'm not as smart or not as talented, and they made a mistake, and they may leave. And that to me is a loss not just for that person, but also for our profession as well, because that person, that individual, that individual could be the person who's anesthetizing somebody really important. That person could be the one who's anesthetizing a parent or a loved one of mine, and who would be doing a phenomenal job, but because of IP, decided to exit the career choice early on before they actually were able to work through these IP feelings.
How
Yeah.
much plays into this with the fact that you're in an ICU? Maybe these individuals are coming from an ICU with a lot of strong personalities, a lot of strong, smart individuals. And also, as you talk about applying to nurse anesthesia school, it's no secret. The success rate of getting into a nurse anesthesia program right now is anywhere around 12 and 13%, right? We're seeing
Yeah.
a large number of increase in our applications. We're seeing increases in program sizes and the number of programs, but maybe not to the extent or to the same level we're seeing the applications rise. So how do both of those play into this?
Well, certainly the simple answer is they they likely factor in. We don't have data yet to definitively say how much of an impact do they influence. We know that they do, but we haven't researched that yet. My guess, my educated guess, as someone who has really kind of bathed in imposterism for quite a few years now, is that it significantly impacts and affects our candidates. We just don't know to how much at this point. That's an area that we're going to be researching next, to really kind of explore its impact and the effect size that IP has on our candidates, on the candidate selection, and then how well they do later on in these training programs.
Hey, future CRNA, another daily dose of inspiration along your CRNA journey. This success story starts with these words: "With all the happiness in the world, I am so excited to say I was accepted into CRNA school, into my top choice school. My journey has been a roller coaster, to say the least. I'm so blessed for this amazing opportunity. Thank you, CRNA School Prep Academy, for all your amazing resources. Your support resources have helped me during every step of this process. I wish everyone on their journey all the strength and positivity. I say with the utmost certainty that if you want it, you will get there. If you envision it, you will have it." I'm going to be a CRNA, you guys. I can't stop crying. So I wanted to share this because some really inspirational words and motivation from the student is that if you envision it, you will become it. If you believe, you will achieve. And while I know some of you may be full of fear and doubt, this is the transition that needs to occur in your CRNA journey. Really, we are unstoppable as human beings. If we really want something, we will go after it at no avail, right? So I hope that leaves you with this positive reinforcement that you are doing your best. And as long as you keep showing up, you're going to find success. So no matter what experiences you think may hold you back, just embrace it, face it head on. You can do this. I'm rooting for you. Let's get back to the show.
Now, question I've got for you here is moving kind of forward a little bit with this. You mentioned already you got the scale, you've got, kind of your feelings that you have. But say that I'm, for example, an ICU nurse out there, maybe one of our listeners, right?
Yeah.
And I'm trying to figure out, do I have imposter phenomenon, or do I just have, feelings of less than? Do I just have, I'm trying to be humble, or do I just really believe that this is not where how do we distinguish? If I'm an ICU nurse and I'm trying to figure out where I'm sitting with this, how do I distinguish?
So the first thing to really do is to use a validated instrument to measure if you truly have imposter phenomenon or is it something else. I recently had somebody a couple weeks ago contact me, and after a couple minutes of speaking with this particular individual, I realized it wasn't so much that they had imposter phenomenon. That certainly could have been there because I didn't use the instrument to measure it in that particular person. But in speaking with them, what came out was that they were suffering from burnout. And so there's these other types of psychological constructs and phenomenons that people feel that there's a lot of crossover in between, even though they're separate and distinct, that may confound the diagnosis of imposter phenomenon. So that's one where people think they have imposter phenomenon, it might be something else. Let's go the other way on this. There are a number of people out there who might have low confidence, anxiety, depression, and so forth, and they're attributing their lack of progress or their pursuit to one of those particular experiences. But really, the underlying problem is imposter phenomenon, right? And so for those individuals, yes, they would absolutely benefit from exploring the dimensionality of imposter phenomenon using like the Clance imposter phenomenon scale. It's a simple self-administered Likert style questionnaire survey, 20 questions. It'll quantify the how much imposter phenomenon is present in that particular individual at that particular time, keeping in mind that IP, like a lot of other things, can wax and wane depending on the context, depending on who you are as an individual, when you're taking it, the circumstances around you, and so forth.
Yeah, because when you think about kind of, especially as a healthcare individual, right, healthcare practitioner, what happened with you on the shift before, right? Who
Right.
was your interactions with? What happened with your patient? And were there any negative effects that came from anything
Sure.
that shift with your patient? So, and you're, interested to talk about how that wax and waning, because you mentioned it before, is the brain's a funny thing. And when you look at the brain in itself, and you look at all the synapses, you go through all of the, functionality of the brain. There's so many signs and symptoms that are crossovers. You mentioned that word. There are crossovers between depression and imposter syndrome,
Right.
or low self-confidence and imposter syndrome. So really teasing out that, and like you said, using that tool is key. All right, so now we've got to that point. So I've diagnosed myself with imposter syndrome. Okay. So I've gone through the test. I've, talked with somebody. I've really got this down that I have it. So how do I become successful and remain successful at that point, and hopefully not have that prevent me from getting where I want to be?
Well, the first thing they've done now that you've diagnosed it, with a validated instrument, right? You've got to name it, right? It's important to recognize that despite 400 studies, despite nearly 50 years of research and dialogues and books, both in the mainstream media and lay literature, as well as the psychological and healthcare literature, imposter phenomenon is not an official psychological disorder. You're not going to find it in the DSM-5 revised. You're not going to find an ICD-10 or ICD-11 code for it. It is a phenomenon. It is not something that is, it's not like it carries a diagnosis like anxiety or trait anxiety or state anxiety or depression and the different dimensions of depression and so forth. So as a result of that, there are no practice guidelines, and there isn't a lot of research into effective treatment and effective management. So what I'm going to share with you now is more under the advisement of the psychotherapists that coined the term. And these have become kind of the recommendations from those initial seminal studies. So the first thing we need to do is to name it. You've got to name imposter phenomenon. You got to call it what it is and test yourself for it with that reliable and validated instrument and see how intense your imposterism feelings are. Okay, putting a name on the feeling and keeping in context when you have those feelings is really essential towards getting in control of it. Okay,
Now,
reflect on, yeah, go ahead.
actually, thinking about that is really not diminishing that, but just really with this population that we've got for an audience, that's pretty much everything we do, right? Whether it's putting an IV in, whether it is IP, whether it is charting, whatever we're struggling with, it's really, and that's going to be key when they get into anesthesia school, because that first test may be more difficult than they anticipated because they haven't taken one in a while, right? That first intubation, because they've never done an intubation possibly, is really recognizing what are my deficits or where am I struggling? Because without recognizing that, then we're not willing to actually seek help or help ourselves in those situations to get better.
That's right. That's 100% correct. I mean, naming it and recognizing it, and then also remember too, teasing out. It's okay to be anxious on your first intubation. I was anxious on my first 100 intubations, and that is perfectly normal. That's 100% normal. It's also normal not to know everything, right? Why? Because we're learners, we're trainees, we're learning how to do something, a whole new world out there, and that's perfectly acceptable.
And I usually have to remind them, I really try to break it down very simple when I've got the nurse anesthesia residents in there and I'm teaching them is, hey guys, remember when you tried to put the Foley in the first time? It wasn't that easy, but then it became very simple for you, right? That's how intubations and some of these other skill sets go.
Hey, future CRNA, as always, I appreciate you and your loyalty. Thank you so very much for tuning in this week. I'd love to hear from you, so screenshot this episode and share it to your IG stories with your biggest takeaway. Don't forget to tag me at CRNA School Prep Academy so I can personally thank you. Be sure to head over to CRNAschoolprepacademy.com to check out our blog and gather free resources to help you along your CRNA journey. Stay strong, and I'll see you next week.